Let's talk more about chronic back pain. Is that the type of back pain most people experience in their lower back?
Well, I would say, Andrew, that that's a great question, and there is a difference between acute and chronic back pain. Most people have some sort of acute back pain at least once in their lifetimes, and the question is that going to resolve with some sort of conservative measure, or is that going to transition into a longer, more chronic type of a picture?
And what does the pain feel like, the difference between acute and chronic?
Well, sometimes it's pretty similar, but generally in the acute phase, it's sharper. And in the chronic phase, while it can still be extremely painful and bothersome, it tends to even out a little.
And just continuously nags you, for example.
Correct.
But chronic back pain can lead to some other conditions.
Chronic back pain can interfere with your life in a whole lot of different ways, and you're exactly right. It can affect the rest of your health in pretty big ways.
And there's something called disuse symptoms?
Disuse syndrome. Yeah, disuse syndrome really is something that talks about the way the body responds to not being used appropriately. So our bodies are meant, each system in our body is really meant to work in the way that it was designed to do so. And if it's taken out of use, it actually starts to deteriorate.
And how do you take your back out of use? You stop doing certain things?
Pretty much. So what happens is that people are just trying to protect themselves from the pain, Andrew. So when you have back pain, and when you have terrible back pain that's worse when you move, worse when you twist, worse when you lift, you simply stop doing those things.